From where the news comes first, this is News Channel 2 at noon.
Welcome back for News Talk, joined by Dr. Renee Wellenstein, live in studio to talk about functional medicine and women's health. A lot of people might ask, what is functional medicine? So let's start with that.
Well, I'm actually double board certified in obstetrics and gynecology as well as functional medicine. So conventionally trained, I went to medical school. I was basically trained symptoms, diagnosis, drug, or medication.
Right.
And in functional medicine, it's a little bit different. Okay. We look at the whole person and we try to get to the root cause of disease.
Right.
So for instance, you may have many symptoms leading to a diagnosis of depression, but we try to get to the root cause of why you have that problem.
Rather than just, sometimes you would go to the doctor and you'd say, okay, I have this symptom, or I feel this way, and okay, here's a prescription, or this is what we're going to do. You kind of look at the whole person.
Correct. And it may not be
entail?
Point A leads to point B. It may not be I'm sad, so I'm depressed. It could be something where their nutrition that's perhaps not agreeing with their body, causing inflammation, leading to their symptoms of what sounds like depression, but maybe if we sort of clean up their diet, maybe they have heavy metal toxicity, and that's we have testing for that.
Right.
Then we clear all that up and they feel better. Now it's not overnight.
Right.
So it does take a little more work, but...
And it would seem that it would take, and again, the number to call, 315-793-9588 if you have any questions for Dr. Wellenstein. It would seem it would take a team of doctors to get to the root of all of, the issues that kind of interactively affect a person.
But you'd be surprised, there are a lot of symptoms that are, the root cause is the same.
Okay.
Even though you go to your regular doctor and perhaps you have this symptom, this drug, because this diagnosis, this symptom, this drug with this. Many times in functional medicine, many symptoms lead down to one root cause, in which case we take care of that, all the symptoms get better.
What made you switch from obstetrics and gynecology to functional medicine?
It's a very long story, so I'll condense it. But in 2012, I fell off a horse and broke my back.
Okay.
And it was a rather serious injury, and completely out of work for 6 months. And for the next 2 years, I chased symptoms that pointed towards depression. And despite not feeling better, after 2 antidepressants, I started looking for other answers. Okay. At this point, I personally got in touch with a functional medicine doctor, and within a month, we had a different diagnosis. It was more of my adrenals, and we started working on that. And it wasn't overnight. Again, over the next probably year and a half. Right. Different person, completely different person. So
it not only changed your perspective on, what kind of medicine you were practicing, but it's personal. It also changed your overall health. Absolutely.
And that's why within a month of seeing changes following this type of medicine, I went back and did a fellowship in it. So after another fellowship, more training and more certification back to school while working, I became board certified in functional medicine as well, because it changed my life and I couldn't keep this a secret any longer. So
thank you so much for joining us and sharing your story.
My pleasure. Thank you for having me.
Sorry to get personal on the story.
No,
it's
great. It's
appreciate
a big
that.
part of the story.
All right, so Dr. Renee Wellenstein, and if you have questions for Dr. Renee Wellenstein, we'll try to have you back.
Absolutely. I'd love to come back.
Thank you. All right,
you.
we'll be back after this.